Antipsychotic drugs are designed to treat patients with schizophrenia or bipolar disorder who experience hallucinations or delusions. However, these drugs are also frequently used off-label to sedate dementia patients who exhibit aggression or agitation. This practice is widespread, particularly in nursing homes. Critics charge that antipsychotic drugs are being used to make life easier for nursing home staff, not for the benefit of the patients. A recent study by world-renowned dementia expert Professor Clive Ballard found that the use of antipsychotics on dementia patients provides no medical benefits and is actually harmful. Ballard studied 165 dementia patients who had been taking antipsychotic drugs for an extended period of time. He then took half of the group off the medication. After 1 year, Ballard found that the patients still on the drugs did not appear to have demonstrated any improvement, nor did those not on the medicine appear to have deteriorated faster. On the contrary, those taking antipsychotics had more trouble thinking and communicating than those who had been taken off the drugs. In addition, evidence suggests that antipsychotics shorten the lives of dementia patients. Cheryl Byrne had personal experience with the effects of antipsychotics when her father, an Alzheimer's patient, was placed on the drugs. After starting the drug course, Byrne's father stopped moving around and became practically comatose, sitting slumped in a chair at all times, except for bursts of agitated behavior. One time, he stood and sat a total of 17 times in 10 minutes. In an attempt to force a resistant nursing home staff to take her father off the drugs, Byrne secretly filmed her father to prove her point. "I never thought he was the same again after he'd been prescribed those drugs," Byrne said. "I thought something was lost." The overuse of antipsychotic drugs on dementia patients is a serious problem. These drugs are not only ineffective, but they can also be harmful. Families of dementia patients should be aware of the risks of these drugs and should work with their loved one's doctor to find alternative ways to manage their symptoms. Here are some tips for families of dementia patients. Talk to your loved one's doctor about the risks and benefits of antipsychotic drugs. Ask about alternative ways to manage your loved one's symptoms, such as behavioral therapy or changes to their environment. Monitor your loved one closely for any side effects from antipsychotic drugs. Report any side effects to your loved one's doctor immediately. Be an advocate for your loved one. If you believe that they are being given antipsychotic drugs inappropriately, speak up.